and eba and rice, coming back to the class will make it a bit very difficult for people to concentrate. But we are going to make this to be very interactive because it's a matter that concerns all of us. It concerns you, it concerns me. And the statistics can really tell us why we need AI to intervene in our health system. The assignment before me is critical. It's critical because it's something that actually makes me to weep most times. Why do I weep? I've visited a lot of hospitals in Nigeria. I've gone to creeks. I've been to Ayetoro in Ondo State. I've been to Ogun State. I've been to several states of the country, and I've seen reports coming from every part of this nation talking about maternal, neonatal, and neonatal mortality and stillbirths. And I wonder that if we do not have the opportunity to bring in AI, we can be very sure that we will never get out of the mess we are in. It is that terrible. And that is why it is important to speak to the experts who are sitting here. I am not an expert, but let me begin by saying that they said we should look at the future of primary health care in Africa, strengthen intersectoral collaboration in AI tech-driven solutions. Yeah, it's great. Why do we need this? Let's begin with these statistics. They said Nigeria is the country with the second highest number of combined estimates of maternal and neonatal deaths and stillbirths globally as of 2020. By that statistics, it says Nigeria loses about 540,000 in terms of mother, child, children, and stillbirths annually. 540,000. And that makes us to be the second after India globally. Now, looking at why do we continue to have this? Because no infrastructure, because no workforce. We have seen, according to MPC-HDA, that only 2.8% or less of primary health care centers in Nigeria has the minimum, the basic minimum required workforce, especially skilled birth attendants in our primary health care centers. So do we now agree that there is a need for us to get intervention? And you look at it, even when they are not enough, they are also drifting abroad. So that shows that it's very important for us to now look at it. What is AI? What do we stand to gain from AI? How can AI intervene without also compromising our record, without also compromising our details? You know, health is confidential. So how do we bring all these things together that we will also not be on the other side of the rule or of the law? So I will be talking to the experts who are here. They are the experts that we need to talk to. And I know that those who are going to take it to the policymakers are also in the house. So thank you so much as you have me here. And I welcome every one of you for finding us worthy of your time, I know you went through a lot of things yesterday before getting here. Thank you so much, sir. Yeah. Now, the individuals that are here, as they have been presented, like I said, we have Obele Oluchi. Thank you so much. Apologies. I was looking for a woman. Sorry. Yeah, we have Professor Shehu Mohammad Tijani from Bayero University. Thank you so much, sir. We have Dr. Francis Ohanyido. If I don't pronounce it very well, kindly pardon me. That punishment should go to CJID. Then we have Kemi Gbadamosi. Is that correct? Thank you so much. That's the Director of Advocacy and Policy, Healthcare Foundation. Then we have Darlington A. Akogo, founder, CEO, Minor Health at Labs. Is that correct? Thank you so much. Now, somebody is here who is actually leading something around AI, and that is the last person that I just introduced. I want him to just briefly introduce what AI is intervention. Because you look at it, people talk about AI, and we understand that there are so many challenges with AI itself. You see GPT or whatever, somebody is stealing somebody's document somewhere and is giving you as a story. Somebody want to write exam is getting something else. So please tell us, are we safe with AI? Can AI intervene? What is AI?
Okay, so can you hear me? Okay. So starting with what artificial intelligence is, right? The whole goal of artificial intelligence is that as human beings, we are capable of intelligence. We do so many things. We can have conversations. You know, you have so many professionals, so many expertise. Computers are good at adding numbers, but then it's difficult to get computers to do what human beings are good at. So the whole idea of artificial intelligence is that can we give machines human-like abilities, especially the ones that we categorize as intelligent? So you give the example of ChatGPT. As you can tell, ChatGPT usually does things that human beings used to do. Writing documents, or for students, doing their homework, or even finance, administrative work. All of these things, ChatGPT is now doing it. But it's not just ChatGPT. There's a lot of AI system. As it connects to us in healthcare, there's a shortage of clinicians, there's a shortage of doctors across Africa. And the potential of AI is that we can then build systems that are capable of automating some portion of what doctors do and then serve as assistant to doctors and be used across Africa. So mostly we are safe if we use it in those contexts, but we need to look at ethics, regulations, and policies to also guide and curtail and make sure everything is done in the appropriate way, because it's a very, very powerful technology.
Thank you so much. He has just broken it down and he said you are safe, so you should be calm that AI has only come to assist us, not to destroy us. Thank you so much, sir. Yeah, let me go to Prof, who is sitting beside you. AI is here now, and I know that even in the classroom, some of you also have things that you battle with. When you give assignment to your students, you know what they come up with, and unfortunately, you cannot determine between the real students and the AI students. So now, within your own, do you think this intervention, how do you marry the effort of the academics and the effort of those who are in the practical, in the fields? How do you marry it together using this innovation?
Thank you, Mr. Moderator. First and foremost, let me thank the journalism and the Center for Journalism and Innovation and Development for this opportunity. Well, I know very well that just like any new technology that arrives, people have fears, they have apprehension, and this is due to the uncertainty which surrounds the new technology because it is not yet properly understood. So, in this vein, people look at the technology as if it is going to do something weird. But I think we are in an era which I believe is pointing towards the future. And unless we take this very, very seriously, we shall be left behind, just like what has happened to the previous industrial revolution. As it is said that the AI technology is now our fourth industrial revolution, we need to know the fact that in every aspect of our lives, AI is going to intrude, and for good reason. In the first instance, AI is a data-driven technology, and that means that there are lots of areas where this can be applied, including in education. Now, let me point out that countries that have realized the importance of AI as the future of mankind, like China, for instance, the State Council in China has already started a program in which primary school and secondary school students will be taught AI with a curriculum that will allow them to key into its potentials. And if a country such as China is already foreseeing itself as a leader in this area, it does suggest to us that there must be something in there which we as a people must also try to see what we can do to start using AI. In particular, even in the educational sector. I've seen, of course, I know that those of us in the universities, we've seen the potentials of AI, especially when it comes to creating content. Now, for students, for us as teachers, AI can speed up certain research processes because there are certain things which takes a very long time for students to accomplish because, of the tedious nature of work. There are certain routine, works which AI can help to quickly, or to quicken the process. And that means that if there are issues that affect society and we need to get a quick decision to solve a particular problem, then the use of AI technology will help us speed the process, help us to arrive at a timely decision, and that will help society to solve problems. And also in this vein, the universities being the center of research clearly needs to start having a curriculum which will allow not just those maybe in computer science or in engineering or in those areas that now, are mainly AI compliant, but in all other fields, AI is required. And so a new curriculum has to be drawn for which present students, including the future ones, will start keying into it. We cannot do without AI. Believe you me, because if we leave it and we start thinking about its negative impact, people want to say maybe it's going to create unemployment, a lot of people will lose their jobs. That is what we had when computer was introduced.
Thank you so much, sir. Thank you so much. You can see we have just picked, we have so many points in what he said, but more importantly is the fact that our curriculum must now be developed to include options for AI teaching, not just at the university level, but at other levels. It's not just in China, as you mentioned. I actually picked up this document in Marrakesh in Morocco just about a month ago, and it is all about AI. I was at the workshop on earth risk reduction conference, and most of the things that were being discussed within the African context is also all about AI. Thank you so much. I don't want our sister here to feel intimidated by the men. So I'm coming back, I'm just coming straight to you, ma. In fact, if not, I should have started from you because it's actually your matter that we are discussing. It's our matter, but it's closer to you. You know, when you are having party somewhere, it will be closer to somebody than somebody. Thank you so much. So I'm coming to you. You have been in the development world. What framework do you think we will need to make this, if you think it is also necessary, what framework do you think Nigeria and Africa, by extension, will need to adopt this AI?
Thank you very much, Mr. Moderator. So let me answer the second question you asked. If I think it is necessary, yes, frameworks and policies, regulatory frameworks, regulatory policies, when it comes to artificial intelligence, even for health. And just to paint a bit of a picture, when we look at the policy framework landscape, policy of the framework landscape in Africa, we've made a bit of a progress in terms of countries that have regulatory framework. Maybe not particularly on AI. Now, if we're talking about AI directly, countries like Kenya, Mauritius, and Egypt have gone far ahead to have policies that speak specifically to artificial intelligence. Now, when we talk about health, artificial intelligence for health, what we see in Africa is that there's still some forms of limitation. Health is regulated by virtue of the fact that, yes, you cannot perform health, you cannot carry out healthcare services or healthcare delivery in any form without some form of guidance. But what we see is that we do have semblance of digital or technology in health in a number of our health-related policies. So we don't really have artificial intelligence in health policies or regulatory frameworks, but we do have some form of semblance. So for example, countries like Nigeria have Nigeria, Kenya, South Africa, we have what we call the digital health policies. Now because again, the move into healthcare, the move into digital healthcare, technology in health has necessitated the fact to have digital health policies. Although unlike countries like South Africa, Kenya, and Zimbabwe, where the digital health policies actually provide guidelines for healthcare practitioners, countries like Nigeria, we do not have that. And it is important to have that because it's not enough to just have a digital healthcare policy. You need to have a guideline for that policy for it to be implemented. Now, if we go a bit further, we talk about telemedicine, which is, remember I said we don't really have AI in health policies or regulatory framework, but we do have semblance of them in either in our healthcare policies. Nigeria used to have the ICT healthcare framework, 2016, and that was basically to bridge the gap in coordination between the ICT sector and the healthcare sector. But then again, when we look at things like telemedicine, we have a lot of uptake with telemedicine, but there are challenges in the sense that we don't have, for some countries, there are no frameworks or regulation in terms of telemedicine, and Nigeria is one of those countries. But you have countries like Zimbabwe that has a policy in terms of implementation of telemedicine. So just to go back to the question that you have asked, Africa needs to get to the point where we do have regulatory policies that are not just embedded in bigger policies of health or data protection. Like we're saying, we have data protection laws. I think we've done very well we're doing very well in terms of data protection laws. We do have data protection laws. We have laws around, registration. Some have gone as far as doing prescription or, electronic informed consent. But we need to have targeted policies or regulatory frameworks that speaks to artificial intelligence in health. And even as we do that, we must also keep in mind that the need is to basically promote innovation on the continent and to also ensure that artificial intelligence, by virtue of its nature, does not commit any harm in so doing.
Thank you very much. Thank you very much. We understand that we have policies here and there, but she is now telling us that there is a need for us to have specific documents that will speak separately to artificial intelligence in health. Thank you so much. I'm coming to the doctor is here. Dr. Francis is representing the whole of Africa. So I will come to you last. Thank you so much. Let me go to my brother at on that extreme end. We have all, at least most persons here have agreed that we need this particular intervention. And they have told us that we need them in the curriculum, we need their teaching in the schools, and we need specific. So to you, how do you think we can actually preach this so that the government of Nigeria and governments across Africa can expedite action to adopt this so that we are not left behind?
All right, thank you. Thank you to Center for Journalism. The topic at this time is really apt, and I believe it resonates across everybody who sits in this hall. Sometime last year, my organization piloted election monitoring using digital tools, and it was overwhelming, some of the results that came out from it. So there's no gainsaying that artificial intelligence is the in thing going forward. Whether we like it or not, it's gradually encroaching into all the spaces, from human cloning to car driven by themselves, to some of the apps and some of the smartphones we use. And just like as a continent or as a country, we are not isolated from these innovations. So for me, I think just like some of the challenges we have run into in the past, in some of the programs that we have copied from Europe or from outside the country, and we have just pasted them hook, line, and sinker in country, I think we should look at some of the benefits of AI, what it brings to the country and to the continent, and that should be the entry point to sell AI to our leaders. We should be basically not looking at, yes, there are challenges associated with them, but we should look at some of the benefits. For example, imagine implementing the midwife service scheme alongside AI. Imagine the beauty of that program, the essence of what it will bring. This was a program that was launched years ago, where you post a midwife to a very remote village, and through access of our phone, through telemedicine, through an algorithm, you are communicating modern science to the person is delivering in that remote country. Imagine the immense benefit. So these are some of the things we need to articulate together and sell them through a holistic reportage that is balanced. When I say balanced, that is informed by data, that is informed by science, that is informed by tech, so that the leaders begin to see the benefits for us to deploy that as against laying back and see what it provides for us. We also need to also sell the benefits of using AI to provide client-based specific services. Recently, somebody just sent me a video concerning human AI. Just a small device you wear on yourself congregates data of an individual, medical, social, everything, and puts it together in one batch. Imagine using that to provide client-specific service, the benefit it brings.
Thank you so much. Thank you so much. Yes, I'm now here to place this before Dr. Francis. Dr. Francis is the Director General of the West African Institute of Public Health. So you can now see when I said it is in Yoruba, they say, Egunla Lonkan Igbale. That is, it is the biggest masquerade that will come out last, because all these, you are the one to actually escalate it to the more than about 54 African countries, right? Now, we understand that there are peculiarities in terms of the challenges facing Africa. Recently, I saw a robot that was controlling traffic somewhere, real or counterfeit, and I saw the reactions that actually trailed it. People, did they respect it? Would they honor it? Would they even listen to robots asking them to go or not to go? Would people not even remove the battery and take the thing away? So there are peculiar issues with the continent of Africa. So I'm bringing it to you. What specific framework, what specific system, how do you think Africa can adapt AI to address all these peculiar challenges? If you do certain things elsewhere, probably you are being monitored somewhere. There's nobody monitoring anybody here. So how do we do this to ensure that Africa benefits from AI?
All right, Mojeed, thank you very much. It's a pleasure to be here. Fantastic event by you. And I think what we are doing here is actually, we are discussing something that its time has come. Its time has come in the sense that I'm sure some of us who are older remember the days of the Olympia typewriter. You walk into any office in Nigeria then or anywhere then globally, walk into this office, see this woman typing, back, you know.
That's my father.
So, yes, so Olympia typewriter, but most of those women became redundant with the age of the computer. What we as Africans need to start doing is that we don't become the novel technology. And in fact, the next superpowers, as we know them, will not become countries that have a nuclear warhead. Know them. They'll be countries that are able to marshal their arsenal, their information. How they use AI to be able to overcome the disadvantages that they have. What AI has for us is that it's going to allow us to leapfrog a lot of things. My brother Obele talked around that a bit. Then the opportunities that lie with it. The opportunities are there. But like you said, like you said, what are the issues? The issues are, one, we need to understand, like you pointed out, that no one shoe fits all. We have peculiarities in Africa. There are socio-cultural issues. There are issues of even governance issues. But what AI will do for us, AI will give us the opportunity to marshal it very well to create equity. For equity, because if you look at our topic, we're talking about primary healthcare, the advantages of AI that come with it across the sectors. If you look at Sustainable Development Goal, the goal 3.8 is actually about universal access to health or universal health coverage. One of the things that AI can do is that AI can enable us to do remote monitoring. AI will enable us to model what the issues are in certain societies based on the algorithm that we're able to develop for it. If someone is in Kebbi State, for example, the peculiarities of a woman who goes to antenatal in Kebbi is unique for Kebbi. The woman who goes to antenatal in Oyo is different. So what AI will enable us to do is to be able to model around those things and be able to pull crowdsource data for us as a country or as a region to be able to understand our peculiarities and work backwards to be able to correct some of those things. That said, the other side of AI is around the policy environment. The issues of data protection is something that we need to have very good guardrails. And the issue of data location too. Most of us use like Gmail, we use a lot of, I won't go into all the names. But the problem there is that most of what we do are in cloud servers, and most of them are not in Africa. How can we make sure as countries and as a continent be able to domicile our data for our own selves here? So they don't become data that other people use, to be able to use it to our own disadvantage in the long run. So we need to set those guardrails too in terms of how do we develop documents or policies that are able to enable us as a people to be able to protect ourselves against that kind of peculiarity. And those are some of the things that when we think about AI, look at computing, machine learning, because these things are coming so quickly, most of our policies are not ready for them. We're always doing catch-up when it comes to technology, and that's a major disadvantage for us. So we need to look at those things and be more futuristic about how we approach them. How do we understand them, and what are the things that, like you pointed out, for example, you have a you have a machine or a robot that is controlling traffic. Will someone go and remove the battery and go and sell it? You know, things like that. You know, so those things are peculiar, and those are things that we need to begin to set the guardrails. We can do that with the policy environment, create the enabling environment in such a way that we have legislations that will protect such assets and make sure that there are consequences for the things that we anticipate may be possibly done to those things. You know, so it's an evolving space, and we need to understand it as well as we are growing. But because it's evolving does not mean that we should not grow with it. We need to grow with it, because if we don't grow with it, the world will leave us there, and we will be looking at and gawking at everybody else when they are moving with it. But I think ultimately, for health, the most important thing for health and technology is the advantages that technology will bring. 3 weeks ago, or almost 3 weeks ago in Kigali, there was the Health Tech Summit, the Africa Health Tech Summit. One of the most attended events during that session, or during that whole program, was the one on AI. Because people were curious, from policymakers to implementers to programmers and even NGOs. Everybody wanted to know, what is AI? Like what he was trying to explain here. AI is that thing that has come. And it's going to be a bogeyman for us if we don't begin to put the right things to be able to make it work for us. It should not be something that should take a life of its own and leave us behind. But it's something that we can work with our own systems to be able to modify it in such a way that it works for us.
Thank you so much, Doctor. Thank you so much. We understand that, as you have said it here, it's an idea whose time has come. In fact, if we are not careful, it is already leaving us behind. So how will we not be left behind? And that is where we feel that it's important for us to hold these conversations. But we will come back to the audience. I know there will be 1 or 2 questions from the audience. So let's just have just 30 seconds from them to give us cogent method that can be adopted, message we can take away from here to pass across to that larger society why we need that AI. So I will start from Madam Gbadamosi. I know your own is advocacy, and you deal with policy. And just like you have shown, you have told us why we need specifically certain policies to be directed at AI in the health sector. So I'm asking you, let us assume that we are not hearing from the government from here. How do we convince the government? How do the citizens take this to the government? Because ordinarily this should be what the government should be doing. But we have taken that responsibility from them. Now, how do we convince the government? You are somebody who advocates. So how do you move from here to ensure that the government also sees what we have seen?
I'll speak on 2 things regarding your question. Number 1 is the use of the media. And I think a lot of times when we talk about AI, we always think that the media doesn't have a role to play. But we've seen that right from interventions around health and health response. I work in the HIV/AIDS response, and we know how very poignant the media is. There is a role for the media to play in terms of amplifying, 1, this conversation we're having about the need for policies or frameworks. Number 2, to be able to amplify the messaging, localize the content so that communities actually build some level of trust in the system, because you cannot move with AI very far, even in health, if people don't have trust for the system. So the use of the media is very critical. But then how the media approaches it would also look at things like the content, digital literacy. It is very important that we prioritize digital literacy, as well as workshops and trainings that talk about the benefits of AI. We know these things, but many people out there do not know. Even the government, to some extent, may not know, because it's usually the fear around that. The second part, which I'll speak quickly on, is the communities. Even as we deploy AI processes, it is important to engage communities in this. We're talking about data. We're talking about making, AI to be to promote equity and not, promote equity. To do that, you need the community involved. So community needs to be part of the deployment process. We need to also train the communities around what the benefits of AI is. We need to work with them in terms of helping them understand how AI in health would help advance healthcare for them. And that way we can get ownership and buy-in, which helps to also amplify the call around AI for health further.
Thank you so much. Mr. Obele Oluchi? Yeah, I'm taking it just further from where she stopped. You mentioned something the other time that somebody introduced something to you. They sent probably a video to you where somebody put
a human AI. It's called a human AI.
So just put in your pockets and it actually collates all the data around you. How am I sure that I'm safe, that it's not all my blood that is gone, that it's not all the system in me that is going? That's the fear of an atypical African. How do we assure Nigerians and Africans in general that it is not another, that, recently, the HPV vaccine, certain people actually said, don't go there, don't do it, because it's an attempt to actually reduce Africa's population, the normal usual, you understand. So how do we convince these people that it is something that we need and not something that is going to actually affect us negatively?
Okay, I'll key in from where Kemi stopped. You will agree with me that whether I would like it or not, AI is one of the strategies for the future. And just like Dr. Francis said, it's one of the keys to achieving universal health coverage, whether we like it or not. AI has come to stay. AI will continue to stay. The way we embrace it is how we define it. Now, I would say 2 things. 1, operational efficiency in areas of health. For public health, AI will leapfrog us in terms of achieving operational efficiency. 2, for us to begin to have that audience education, which I call audience education, as segmenting your messages according to your target population. We saw the dangers that happened during COVID in terms of messaging, the counterfactual arguments and all what's not. Even the vaccine that you brought out, how have we engaged the public? Who are the critical stakeholders have we engaged? So those discussions need to start. They need to jump off. And how do we jump them off? Engaging the media. They need to provide the facts. They need to look at the counterfactual arguments. They need to bring it out balanced. They need to fact check. And they need to sell AI the right way it should be sold. And the truth should be told about it. Finally, before I shut up, data protection, very critical. How do we deliver on that to ensure that people's health informations are secured and kept in the right places? Because I don't think for now any African country has the capacity for cloud data storage. So we need to start discussing that in terms of policy-wise and in terms of framework and overall operational efficiency. How do we improve it using AI? Thank you.
Thank you so much. Thank you so much. It's unfortunate that the planners of this event did not put a media person on a hot seat here. Because everybody wants you talk, you come, you go, you end up using the media. But unfortunately, the media itself is overused, is overstretched. The media itself is troubled. Am I lying? Now, people talk about using the media, not about helping the media. Now you want the media to be useful. Unfortunately, most media houses are now struggling to survive. I will allow Professor Umaru Pate to come back to be our panelist to respond to that. But going forward, you are an expert, sir. I'm talking of Mr. Akogo, right? As an expert in that sector, and as somebody you have seen, they said we need to engage, we need to do this. We are now talking about that health sector specifically now. As somebody who has been doing things around AI, what specific AI tools do you think we will need to manage our primary healthcare sector, which is the basic where every typical African needs attention?
Okay, so I can actually give you examples of, things we are actually doing or have done. So to tell a brief overview about Mino Health AI Labs, we actually have been around since 2016, which even in the global landscape makes us one of the first modern-day AI companies. So even for OpenAI and the rest, they started around that time. And we've built a number of AI systems. So we built AI system for radiology. These are AI systems that can look at medical images and interpret it. And we've built AI systems for microscopy, so AI systems that can detect malaria. Look, during the COVID period, we did a number of work. We have AI systems for cancer, oncology, molecular diagnostics, drug discovery, and the list goes on and on. We've done this work with partners from all over the world, from World Health Organization to Imperial College London, Oxford University. And then, so the AI for radiology system that we actually have, we did a clinical evaluation of this AI system. That's the first clinical evaluation of AI system done in Africa. And then we got regulators to approve the AI system. So we have the first certified AI system to be used in clinical settings in Africa. So it was certified under the tagline or under the description of software as a medical device. So talking about regulation. So we got Ghana FDA to certify. And then we have users in 54 different countries around the world. The US, Europe, China, and the list goes on and on. So the AI is no longer something that would happen in the future in Africa. It's already here. We have hospitals across the African continent and other parts of the world that are using our AI system to improve patient care. And then the project we're actually working on right now with, backing of the Bill and Melinda Gates Foundation is similar to ChatGPT, but for healthcare. So this is an AI system that you can have medical conversations with. You can even give it patient's medical images, microscopic slides to analyze it and give you results. And this is an AI system. It's basically the first in the world that we are building. So I'm giving these examples to highlight that AI is already here. What we need is more partnerships.
Thank you so much. Thank you so much. We are rounding off. This is actually the last set of questions for the panelists. I think this is the second round. And I'm going to Prof. Prof, we have said it. And you just told us that it's very important. And part of what we should do is to build curriculum that AI issues will be embedded. Now, going forward, you are going back to that classroom. You have where you discuss and things like that. There are institutions meant to do this. How do you think we can engage them to achieve your recommendations?
Well, thank you. The issues surrounding the use of AI everywhere, including the academia, as I said earlier, its time has come and we cannot shy away from it. Of course, there are fears that when you introduce AI to the classrooms, it may be abused by the students because that will mean students, just like what happened in Australia one time when students were in exams and they were allowed to use their phones and students end up using AI to get answers. Quite correctly, there are fears of that nature which must be taken into account. But what is there is that if there is a curriculum which, is there for students to learn AI, not just in those faculties or departments that naturally, of course, we know they have AI as part of their curriculum, but including all other faculties, not just those in computer science or engineering, because the AI has potentials for just about everybody.
Thank you so much.
So as a result, one thing I want to add here is that if we look at the partnership that somebody was talking about between, say, the academia and the health sector, for instance, obviously we know that the academia often is engaged in abstraction. Yeah. And knowledge, as we know from Albert Einstein, is that knowledge is limited, but imagination can take you everywhere. And as a result, we need more imagination coming out from the universities, which will now be married with those who are engaged or those who are the practitioners.
Thank you so much, Prof. Thank you very much. Thank you very much. Yes, I now come down to Dr. Francis. Your organization, which is West African Institute of Public Health, this is an African institution. Recommendations have been here. How are you taking this message forward? Just in 1 minute, sir.
Okay, so when I was talking earlier on, I didn't mention the fact that Africa has gone one step further in a sense that at the continental level, there's what is known as the digital transformation strategy of the African Union, which is championed by the Africa CDC. And within this DTS, there are pillars, critical pillars, and some of the conversation we've had here push or rather plug into those pillars. One, for example, Gbadamosi talked around the issue of watchdogs. The media, the role of the media is very critical. It's a critical pillar because they are the fourth estate of the realm. That role has to be built up in such a way that it helps the process of moving AI to reality that is responsive to our needs as a continent. Then the other side is also capacity development for the ground zero people, the frontline health workers. How do you make them to understand the opportunities with AI? Because mobile telephone is everywhere. Mobile penetrance in Africa is, especially Kenya, Nigeria, is one of the most pervasive in the world in terms of penetrance. And that's an opportunity in itself. So when you are talking about a digital bridge, really, it's a bit difficult to say that now for most African countries like Nigeria, because people have one phone or the other in their homes. And most of them these days are not dumb phones anymore. They are actually smartphones. So that's an opportunity to be able to begin to use those platforms to begin to engage people, to make them better and more responsive to the use of digital technologies like AI.
Thank you so much. You still brought us to where we actually almost ended the other time. Professor Omar Pate was not on seat when we mentioned his name, that the organizers of this event refused to put a media personality on the hot seat here. But everything they have been discussing revolves around the media. Everybody wants the media to be involved, to actually preach the gospel. But unfortunately, sir, let me give Professor Pate that microphone to help us. But we are telling them that the media itself is troubled. So how do you... No. I am not. I am interrogating them. They are not taking me as a panelist. I am interrogating them. So what we are doing here now is that the media itself is troubled. The media is challenged. Now everybody is carrying all the load of this world on the media. When you go to the newsrooms today, you realize that a whole lot of them is either they are not paid, or those who are even paid are overstretched by the volume of the work. So how do you think this can be resolved, sir? This is the last, and unfortunately, we will not be able to take comment or questions from the audience. So, Prof, please, microphone, please. Thank you so much, sir. It's because I didn't have that power to bring you.
Thank you, distinguished panelists. It has been an exciting session. If we give you all the time, is it a professor or an old teacher who is a director, or is it an NGO activist that will not be talking for hours if you give him or her the time? So we thank you most sincerely on behalf of the board. And for the issues that you have raised, not only the media, every other sector is affected. For us in the media, it's been specific. In the last few months, I've attended 2 major conferences, one in Taipei in Taiwan, that is the World Editors Congress, I think in September or thereabout. Then the last one, I don't know whether you also attended, the one in Sweden. In Sweden, it was AI and investigative journalism. The other one in Taipei, it was AI and journalism. And the issues are clear. These technologies are real, they are open us, and the options we have is either you innovate, accept the reality, and see how you can shape in, or you reject, stagnate, and shape out. And the media is not willing to shape out. Definitely, we have to shape in and see how we can embrace these technologies and mainstream them into the things that we have been doing. The advent of the internet and the revolution in information and communication technology, including AI, has caused 3 major problems for the media, or 4. They have created enormous and limitless opportunities for us. They have also created 4 fundamental problems that are affecting the industry. 1, the issue of funding. 2, the issue of technology. 3, the issue of content. 4, the issue of credibility, all these fake news and all others. And the last one, the issue of safety and freedom for those of us who are in the industry. Each one of them could be a paper if I'm to extensively discuss here. We don't have the time. But the truth is, the media is gradually and increasingly adjusting to mainstream these realities, even if not in this part of the world, but elsewhere. And I'm sure we will also be there. In the universities, for example, we have just changed the entire curriculum for the training of the media professional in Nigeria. I chaired that committee in the NUC, and we have submitted, and government has approved it. We took into consideration the innovations and the evolving reality of these technologies. And what did we do? We tried to change the training of journalists so that these technologies can be mainstreamed for them to graduate, accept the realities, and even before graduating, they become skilled, multi-skilled, and efficiently equipped for us to benefit from these technologies instead of simply becoming onlookers. And then everything will move. Before we wake up, the world has gone to another revolution. So I don't think I will have the time to go into all the details. But like I've said, we thank you for expanding our horizon and increasing our level of understanding on some of the issues and the connections, particularly in your own area of specialization. I hope our journalists here are also learning to see how we can also wake up like you people have been doing in the health sector, for us also to take note and see that in the media sector, particularly in Nigeria, West Africa, we are also able to develop the skills and come up with innovative ideas that can save us from the consequences of being uninformed or not mainstreamed. We thank you.
Thank you so much. With that final note from the chairman of the board, we have come to the end of this session, but we believe that CJID will take this further by ensuring that the policymakers are adequately informed. Thank you so much for having me all along, for having you as the only woman here. We thank you so much for not being intimidated. Thank you so much.